see topics that we could all benefit from. As you know, disaster management is more to do with the planning. Planning how if disaster does strike and how do we do it to reduce the effects of those disasters in our community. The events that are covered by disaster management are terrorism, sabotage, fire, and natural disasters like earthquakes and hurricanes. Okay, out of this, I must say we have chosen a very small topic in disaster management, which is first responders. First responders are the people who are at the site of the accident or the incident or whatever natural disaster that has happened. That it is really wonderful to have doctors in front of me, but you can have the community as well. An idea of this workshop is when we all go back to our places, we need to introduce this kind of workshops to educate the people who are not even trained medically, because we can help save lives if we practice all these things regularly. Idea of this workshop again is to give you the basic techniques which would save life, and at the same time we can improve the outcome of the patient if we know how to do it just exactly the way it has been taught. I have specifically avoided all the very detailed topics of anatomy and physiology and other things and the causes of all the respiratory arrest and the heart attacks, because the audience is doctors, and I'm very comfortable that we'll go back and regard it whenever you go and kind of train other people there. Okay, the first responder training, basically we are training people to get all the knowledge for one specific thing, is to save life. And this is all we have concentrated on today, is to give rescue breathing and CPR. Eventually, that is what would matter. An idea of getting all this knowledge is that whenever it happens, you are confident and you have the knowledge at the back, and staying calm and not panicking and helping all the other people who are not trained, as well as helping the casualties and saving their lives too. The most important part for any first responder here is you have to look for your own safety. You have to be a part of team that would save life and not become a casualty yourself. It is not going to be a very emotional kind of a trip when something like that happens. You should stay calm, do not panic, observe the situation, and you have to respond to that casualty, first calling 911 or 1122 for that matter in Pakistan, and give them the right kind of information so that they can dispatch the right kind of people to help the casualty. The cardinal rules for the first responders are: keep calm, do not panic, make a very quick visual assessment. Now this is what we have to practice now, even when we are going on the road and if some accident happens, you'll have to observe the site of accident. How many people are involved? What kind of accident is there? Is there more than one person that is involved, so that when you call for an ambulance, you'll have to call for 2 or 3 ambulances. And if, may God forbid, if somebody is trapped in the car or under a rubble, then you have to inform the emergency medical services to give you the feedback in that same matter. Our basics in saving lives comes to ABC, as we all know. It's airway, breathing and circulation. But before we even start, you'll have, as I said, you'll have to remove the casualty and yourself away from the danger, if you can. If you think it is dangerous for you, you do not proceed, you only call 1122 and let them come back with the help that is needed. As I keep stressing on the visual assessment, because that will really define the outcome of that accident, you being the help to save life. You will have to see what has caused the accident, how many casualties are there, how many are severely injured, what other things, if somebody is electrocuted, if there's a chemical there, if there's a building that is falling, everything has to be related to the emergency medical services with the ambulances that are coming in. Okay, I think I've stressed that already. Okay, reporting the incidents, as I have already said it, that would help. We'll have to practice that. Practicing in the sense that you'll have to be very specific, as in, I see 3 people in a car and they're stuck in there with all the metal that is locked around them, so that when the emergency medical services come in, they'll have that kind of salvaging equipment, and which can save their lives as well. And if you see people who are bleeding too much, before you even get to them, you'll have to tell the emergency medical services this is what the scene is like. Remaining calm, I guess that would be the pinnacle here, because your calmness and your not panicking would help to save life, relate all the information to the medical services. Again, the basics remain the same, that you treat the severely injured people, and severely injured people are probably those who are not making too much noise, because maybe they are going through shock, or they have bled too much or something like that, so that you have to attend the people who are more severely injured. The best thing to do here is looking, listening, and feeling. Idea is to observe. You listen to the patient as well, and then you feel that too. If the people who need help here would be, how would you report to the most severely injured patients? Just to give you the importance of it, I must tell you, when you stop breathing, when the patient stops breathing, and the heart would stop as well, in 0 to 4 minutes, clinical death is certified. And in 4 to 6 minutes, brain damage is possible. And like that, we do not have time. This is how we practice. When you see something, you'll have to practice in the shortest possible time, make a decision, call for help, and then get down to work. The first responders, our workshop I have divided into 2 main topics. One is rescue breathing, which is mostly in respiratory arrest, and CPR for cardiac arrest, of course. Now, this workshop will teach you how to prevent, recognize, and treat the heart attacks and stroke, and see how, because my colleague, Dr. Akil Bajwa, will start performing it. You'll have to master the technique of CPR and the rescue breathing, so that we can actually do it right and save lives. Okay, as I mentioned before, airway breathing and circulation are the main things that we will be looking at. Dr. Kim will start with the, once you have to open the airway, we call this head tilt or chin lift method. I'll show you the video as well after that. If people really cannot see it, you can come close and have a look at it right at the stage. Tilting the head back and lifting the chin will move the tongue away from the back of the throat and allow an open airway. I have a small video for that. Yeah.
Open the airway using the head tilt, chin lift method.
Tilting the head back and lifting the chin will move the tongue away from the back of the throat and allow an open airway.
Let's take a look at that on a model.
I think that expresses that when you tilt the head back to chin lift method, you actually open the airway. Even if there's an obstruction, that will be removed and they will find out how you do it. Okay, check for the breathing, and idea to check the breathing is to bring your face closer to the nose and mouth and feel for the air. And that should not be done for more than 10 seconds. I'm again and again stressing on the time that we spend on each patient, so that the time is lost. That is a very precious time if you want to do something interventional to save the life. Okay, instructions are there. Dr. Gill, I'll play on the video.
Relation check.
Open the airway using the head tilt, chin lift method. Check for breathing by looking at the chest and feeling for air for no more than 10 seconds. If the person is not breathing, give 2 slow breaths.
The 2 slow breaths with 5-second interval is the main thing, because then we are supplying oxygen and we are trying to revive the person's respiration as well. Once the 2 breaths are given, we'll have to look for the sign of the movements, coughing, or anything of life basically. And if we had to check the circulation, we'll have to look for the carotid pulse. I really think we are all doctors here. Carotid pulse is right from the trachea. If you move down to the groove and you press a little, you'll feel the carotid pulse. And this should not be done for more than 10 seconds either. This is all we are checking after the breathing. We are checking for the circulation. Here, the things to consider are, which are important if you suspect the patient with spinal or head injury. This is called jaw thrust method, and Dr. Keane will perform it, and I'll show you the video as well. Be sure not to move the head and neck while you're opening the airway.
Tip 1. Open the airway with a jaw thrust if a head or spinal injury is suspected. Lift jaw upward using index fingers. Be sure not to move the head and the neck.
I'll play this video again. Jim? Okay. While we are giving the rescue breathing, we must ensure our safety, and that is not to transmit any diseases from the patient to yourself. So you can keep either the protective clothing, we may have the hankies, we may have the tissues, but usually the emergency medical staff have, could you raise that, just to show them the protective clothing for the man. Now, if the patient is breathing, put the patient in recovery position. Recovery position is, I'll show you the video so that you can understand that better.
Tip 3. If the person is breathing, place them in the recovery position. Take the arm closest to you and lift above their head. Grab their leg and their other arm and bring them gently to their side. Once they're on their side, monitor the breathing and keep the airway open. And await arrival of emergency medical personnel.
Yes, this is how you do it. Thank you, Dr. Also, if the patient begins to vomit, you'll have to put the patient again in the recovery position so that the aspiration would not cause more complications. I'll show you the video for that, and Dr. K will perform it too.
Or if the person begins to vomit, place them in the recovery position. The recovery position will prevent aspiration or choking and keep their airway clear.
Okay. Now we will start with the adult rescue breathing. I would like you to please concentrate on the timings and the technique that Dr. P will and the video will show you. Give 2 breaths. Once the breaths go in, check for the signs of breath circulation in the carotid, pulse, movement, breathing, and skin color. I think. Idea of this, giving this repetitive oxygen, this is what we call rescue breathing. If the person is not breathing but has signs of circulation, initiate again the rescue breathing, which is do this for 1 minute, that is 12 cycles. And you have to see the chest has to rise, just to make sure that the air is going into the lungs. Please make sure when you're giving the rescue breathing and you have tilted the head, the chin has to be the highest point to ensure that the airway is open. When ventilating, make sure the nose is closed so that all the air goes into the lungs. Use breathing barrier as Dr. P has shown you wherever possible. Please watch this little videos just to remind ourselves.
If the person is not breathing, but they still have signs of blood circulating, this means that the heart is still pumping blood around the body. But the person is not breathing. So ask yourself, what is the only thing the body needs? If you answered oxygen, you're absolutely correct. And giving repetitive oxygen is called rescue breathing.
Rescue breathing is given to someone who has stopped breathing but still has signs of circulation. By giving rescue breathing, you provide oxygenated blood, which can help keep the vital organs alive.
If the person is not breathing but has signs of blood circulation, initiate adult rescue breathing for respiratory arrest.
For an adult 8 years and older, give 1 breath every 5 seconds. Keep oxygenating the blood. Do this for about 1 minute, 12 breaths. A few things to remember when giving rescue breathing is to make sure the chin is the highest point of the face. This ensures an open airway. When ventilating, make sure the nose is closed. This will allow the air to go into the lungs. Use a breathing barrier if you have one available. If not, use the mouth-to-mouth technique. Look at the chest to make sure your breaths are going in. Each breath should make the chest rise.
Did you know the air you breathe out contains 16% oxygen and 5% carbon dioxide? This means when doing rescue breathing, you are still supplying enough oxygen to keep the person alive.
After giving rescue breathing for approximately 1 minute or 12 breaths, stop the rescue breathing technique and recheck for signs of blood circulation. In other words, check to see if their heart is still pumping.
If the person is still not breathing but has signs of blood circulation, continue the rescue breathing sequence. Continue rescue breathing until emergency medical personnel arrive and take over. You are too exhausted to continue. The person begins to breathe or vomit. the person loses.
Now you must just say rescue breathing is done when heart is pumping, the blood is being circulated, but it's not being oxygenated. And rescue breathing, this is what it does is oxygenate the blood. So idea would be to give 12 breaths per minute, recheck for signs of circulation, recheck for any other improvements, if not, continue. Now we'll come to CPR. The CPR is probably as important as rescue breathing is. This is given when you realize the heart is not pumping and the person is not breathing, which means if you leave the person like that for 4 minutes and onwards, the person, you may lose the person. Please watch this video.
Initiate adult CPR for cardiac arrest.
To find the hand position, place the heel of the hand 2 fingers above the bottom of the sternum. Crawl up the ribs, place 2 fingers above the bottom of the sternum, and plant the heel of your hand above the 2 fingers. An alternative way to landmark or find the hand position when doing CPR is to take the heel of the hand and place it directly in between the chest muscles, also known as the lower half of the sternum.
When giving 15 compressions, keep your arms at a 90-degree angle to the body, keep elbows locked, compress sternum 1.5 to 2 inches. Do 15 compressions in 9 seconds, about 100 compressions per minute. Keep fingers off the chest.
Give 15 compressions, 1.5 to 2 inches deep. Compressions will force the blood out of the heart and circulate it throughout the body. Give 2 slow breaths to oxygenate the blood now. Continue 15 compressions and 2 breaths for 4 cycles. CPR circulates and oxygenates the blood. It helps to keep the brain and vital organs alive. A few things to remember when doing CPR is to keep your arms at a 90-degree angle to the body. Keep your elbows locked. Make sure your arms are straight up and down. When doing compressions, make sure that you're pushing at least 1.5 to 2 inches deep. If you feel the ribs break, keep going. Let's sit back and watch the rest of the 4 cycles. Once you have completed 4 cycles of 15 compressions and 2 breaths, stop CPR and recheck for signs of blood circulation for no more than 10 seconds.
If the person is still not breathing and has no signs of blood circulation, continue adult CPR for cardiac arrest.
Let's take a look at CPR simulated on a real person.
Continue CPR until emergency medical personnel arrive and take over. You are too exhausted to continue. Signs of circulation return. The area becomes stable.
Okay, Dr. Gill, could you please come with Nadi and again perform so that, and we can invite some volunteers as well if they want to do CPR. CPR is done when heart stops beating and the person is not breathing. So idea would be to start the circulation and initiate the breathing as well. 15 compressions and 2 breaths. I think we're done with the CPR and the rescue breathing. If there are any questions, and if somebody wants to come and perform it, please feel free to do it. Okay. The next important topic for any first responder would be in open mode. And because we are still talking about when the accident happened and before the ambulance arrived, what would you do? So that is the basics again: apply pressure, no tourniquets, and remove the constricting rings and the other jewelry, and prevent wound contamination. And if you can remove the major contaminants, this is what you do. Again, fractures, this is we are talking about before we have anything there. I think the managing fractures in the as a first responder, you'll have to improvise things. You'll have to find out the basics is immobilize the area of the fracture and apply ice if that is available. My presentation is basically over. If you have any questions, please feel free to do that. Does it mean nobody has understood or?
Assalamu alaikum. Very good presentation. Thank you so much. I had one question. So we were also taught that if you do chest compressions first and go to breathing after it, that's something which is they're developing on the new BLS. It says that you should do compression first and then do the breathing. So what about that?
I think what they've done is they have basically separated the rescue breathing and CPR. But in CPR, you do compression first, so the heart starts to circulate. Because if you're oxygenating the patient and the blood is not circulating, I don't think it would make too much of a difference. You'll have to have a circulating blood for that to carry the oxygen that you breathe in. So you'll have to do compression first and then go for the breathing.
So as first respondent, we should check for circulation. If it's not present, start the compression and then go to breathing.
Yes, yes.
Thank you.
Assalamu alaikum. Sir, I want to ask whether we have to check carotid pulse or not before starting the CPR.
No, we do. You see, all the basics that you want to see the life in is check for the movement, check if the patient coughs, check if the carotid pulse is there, because carotid pulse is probably the first of the things that you check for to find out if the heart is pumping or not. See what I mean? And if you can look at the skin color as well. But depending on the light, depending on where you are, the skin color may not be that good a judge. But feeling for the carotid pulse, I think that would really weigh it. Have I answered your question?
Yes.
Assalamu alaikum. I want to ask that can we perform CPR on pregnant ladies?
Yes, you can. Yes, definitely you can.
Any precautions on anything?
Well, I have not really covered pregnancy in my this workshop. The idea is you can definitely do it. But there, I think idea would be to save the mother. And if you want to save the mother, you'll have to do CPR to keep her heart beating and to oxygenate her blood.
And what about children less than 8 years?
We have not covered that in our essay.
Okay, thank you.
I want to ask about that if the patient has burn injury and or the oropharynx or nasopharyngeal region, then if he is responding and patient, if simply we can ask single question, what is your name? If he is responding that my name is Flan,
Yes.
then definitely we have no need to go for the
Not at all.
no, yeah.
Yeah.
If he is not responding, then we will go proceed for
Sure. That's
that.
for sure.
And in a disaster and a trauma patient, we are also for the breathing. We will see the either patient has a pneumothorax or not, or pneumothorax or not, or there is a cardiac tamponade is there or not. We also look for the signs of this
You're very right.
at the same time.
But I had explained right in the beginning that we are talking about first responder. We are walking along with nothing on it, and we come across a disaster. Idea would be to measure, as in looking at it, feeling it, and addressing that disaster to the medical services, and in the meantime, if you can save any life. I think all that happens when you go either to the hospital or when the ambulance arrives. You know what I mean? That would not be in the scope of the first responder, because first responder, it's fortunate that we have most of the doctors here. But first responder cases are done for any layman as well who has no knowledge in medicine whatsoever. So idea would be if all our people are trained, I'm sure we'll have a better chance of surviving or saving lives.
Dr. Suri's point to add over here, that as the first responder should not forget to check the patency of airways. And in that, he has to swab his fingers in the oral cavity, index finger in the oral cavity, to check and remove any unswallowed food or a pair of dentures which the patient might be having. They have to remove it, and the tongue, if it is falling back, has to be brought straight, so that when you lift the chin, the patency of the airways has to be maintained. Simply, if you maintain the patency, sometimes it is a
life-saving itself.
It's a life-saving process itself.
Thank you.
So, how are we going to support the neck in case of neck injury or cervical spine injury?
Okay, I'll demonstrate that right at the end. When you are transferring the patient to the ambulance and to the hospital, we'll do that right at the end.
Okay, thank you.
Okay, if you allow me, can I answer the question from the lady side regarding pregnant ladies? Since I've been involved in obstetric anesthesia, I'm a anesthesiologist from Karachi, Dr. Malik. So for ladies who are pregnant, CPR has to be performed as quickly as possible. And previously it was mentioned that it has to be a left tilt so that vena cava compression is removed from it. But nowadays it is said that it is better to push the fetus or uterus to the other side or pull it to the other side, because in making the patient a lateral tilt, it becomes a little bit more difficult to do a CPR effectively. So what is more important is effective continuous CPR without interruption. So the thing is that you don't need to feel the lower xephisternum and then go 2 centimeters. Just keep your palm over the sternum and start CPR at a rate of 100 per minute. With maybe the patient is supine, but push or pull the uterus to the other side.
Thank you. Thank you, sir. As I had mentioned right at the beginning, idea of this workshop is just to give you a hint of what we are, as a doctor, we're not concentrating on. I think so. And there are lots of people like-minded too. That we are not concentrating if we are an anesthetist, we are cardiologist, we are gastroenterologist, but doing CPR, doing rescue breathing, knowing these little tips that we could save life, I think we will need to concentrate on that. And probably that's why we did not include that pregnancy part of it, because idea is to give you a hint, and then we all go back and start reading on the emergency medicines. I think that would really help, because there are so many topics to cover here. If we would not be able to finish till by 2-3 hours. Idea is to give you a hint, and then we all start reading about it. Yeah. Dr. Kim, could you please perform that, Nadi? How to shift the patient with spinal or head injury and then joint first. Yeah. Can we have one more volunteer, please? Idea here is to keep the airway patent. At the same time, we do not move the neck or the head. Idea would be to stabilize the shoulders and the neck. And yes. And you put the stretcher in the back, the spinal cord, and then you can transfer the patient. I must mention at the end of this workshop, all these mannequins and lots of other things were very kindly supported by Dr. Suhail Mukhtar of Ahmed Medics, and we are really thankful to him because having all this makes life a little simpler and it becomes a little easier for you to understand as well while demonstrating it. If you allow me, I'll play that video I've shown you in clips throughout. I think that will be more informative for you. Is anybody there to help me?
The following video will focus on emergency care for the adult casualty who is 8 years and older.
When the breathing stops, the heart will soon stop beating. 0 to 4 minutes, clinical death. 4 to 6 minutes, brain damage possible. 6 to 10 minutes, brain damage likely. After 10 minutes, irreversible brain damage, biological death. Are you prepared?
In this video, you will learn life-threatening emergencies and the life-saving techniques to deal with them. In this video, you will learn rescue breathing for respiratory arrest, which means the person has stopped breathing. You will also learn how to perform CPR, known as cardiopulmonary resuscitation, or cardiac arrest, which means the breathing and the heart has stopped. Cardiovascular disease, such as heart attack and strokes, is still our #1 killer. This video will teach you how to prevent, recognize, and treat for a heart attack or stroke. You will also learn how to clear an airway obstruction or a choking situation.
Let's begin.
If you come across an emergency situation that requires your immediate attention, the first thing to do is stay back and check the area for danger. Approach the scene if it appears to be safe. If it is not, stay back and call 911. Once you've determined that the area is safe, approach the person and try to wake them up by gently tapping them. Tap or gently shake the person and shout to see if the person responds. If the person does not respond, immediately call 911. If you're by yourself, you'll have to make that call. Otherwise, try to get someone else to do it.
If the person does not respond, have someone call 911 or make the call yourself.
Once you're confident that 911 has been called, the most important thing to do at this point is open the person's airway, check to see if they're breathing, and check to see if their blood is circulating. In other words, if their heart is still pumping. An easy way to remember this is your A, B, C check. And this is how you do it.
Begin an A, B, C check for life-threatening conditions. A, airway.
Open the airway using the head tilt, chin lift method.
Tilting the head back and lifting the chin will move the tongue away from the back of the throat and allow an open airway.
Let's take a look at that on a model.
B, breathing.
Check for breathing by looking at the chest and feeling for air.
Check for breathing by looking at the chest, listening and feeling for air for up to 10 seconds.
If the person is not breathing, give 2 slow breaths.
When giving 2 slow breaths, keep the airway open, seal the nose shut. Place your mouth around the person's mouth with a tight seal. Give 2 breaths, each lasting 2 seconds. Make sure the chest rises. Use a breathing barrier when possible. C, circulation.
Once 2 breaths go in, check signs of circulation.
Check for signs of circulation by looking for movement, effective breathing, coughing, and appropriate color of the skin.
For the more experienced rescuer, you may also check for the presence of a carotid pulse. To find the carotid pulse, place your 2 fingers on the windpipe and slide them toward you onto the groove at the edge of the windpipe. Check for circulation for no more than 10 seconds.
Let's review the airway, breathing, and circulation check.
Open the airway using the head tilt chin lift method. Check for breathing by looking at the chest and feeling for air for no more than 10 seconds. If the person is not breathing, give 2 slow breaths. Once 2 breaths go in, check signs of circulation by looking for movement, breathing, coughing, and appropriate skin color for no more than 10 seconds. For the experienced rescuer, you may also check for the presence of a carotid pulse.
Things to consider.
Tip 1. Open the airway with a jaw thrust if a head or spinal injury is suspected. Lift jaw upward using index fingers. Be sure not to move the head and the neck. Tip 2. To prevent disease transmission, use protective equipment. A breathing barrier should be used if you feel any risk. Tip 3. If the person is breathing, place them in the recovery position. Take the arm closest to you and lift it above their head. Grab their leg and their other arm and bring them gently to their side. Once they're on their side, monitor the breathing and keep the airway open. And await arrival of emergency medical personnel. Tip 4. If the person begins to vomit, place them in the recovery position. The recovery position will prevent aspiration or choking and keep their airway clear. Please pause the video and discuss how to perform an airway, breathing, circulation check, and the importance of it. Let us learn now when and how to perform adult rescue breathing. Always begin with an ABC check. Following the 911 call, open the person's airway, check to see if the person is breathing, and if they're not breathing, give them 2 slow breaths. Once the 2 breaths go in, now check for signs of blood circulation. If the person is not breathing, but they still have signs of blood circulating, this means that the heart is still pumping blood around the body. But the person is not breathing. So ask yourself, what is the only thing the body needs? If you answered oxygen, you're absolutely correct. And giving repetitive oxygen is called rescue breathing.
Rescue breathing is given to someone who has stopped breathing but still has signs of circulation. By giving rescue breathing, you provide oxygenated blood, which can help keep the vital organs alive.
If the person is not breathing but has signs of blood circulation, initiate adult rescue breathing for respiratory arrest.
For an adult 8 years and older, give 1 breath every 5 seconds. Keep oxygenating the blood. Do this for about 1 minute, 12 breaths. A few things to remember when giving rescue breathing is to make sure the chin is the highest point of the face. This ensures an open airway. When ventilating, make sure the nose is closed. This will allow the air to go into the lungs. Use a breathing barrier if you have one available. If not, use the mouth-to-mouth technique. Look at the chest to make sure your breaths are going in. Each breath should make the chest rise.
Did you know the air you breathe out contains 16% oxygen and 5% carbon dioxide? This means when doing rescue breathing, you are still supplying enough oxygen to keep the person alive.
After giving rescue breathing for approximately 1 minute or 12 breaths, stop the rescue breathing technique and recheck for signs of blood circulation. In other words, check to see if their heart is still pumping.
If the person is still not breathing but has signs of blood circulation, continue the rescue breathing sequence. Continue rescue breathing until emergency medical personnel arrive and take over, you are too exhausted to continue, the person begins to breathe or vomit, the person loses signs of circulation, the area becomes dangerous.
Please pause the video and discuss the meaning of respiratory arrest and why we give rescue breathing. Let us now learn when and how to perform adult CPR, also known as cardiopulmonary resuscitation. Did you know when the breathing stops, the brain begins to die in 4 to 6 minutes? The average 911 response time is 9 minutes. Without immediate CPR, the person has little chance of survival. If the person is not breathing and they have no signs of blood circulating, this means that the heart has stopped pumping blood around the body. So what we need to do is immediately give the person chest compressions to circulate the blood and breaths to oxygenate the blood. When you combine chest compressions and breaths, you're doing CPR and you're helping to keep them alive. Signs of no blood circulation include unresponsiveness, no breathing, no coughing, no movement, bluish color of the skin, absence of a carotid pulse. If you are unsure whether the person has signs of blood circulation, don't delay care. Just begin CPR.
If the person is not breathing and has no signs of blood circulation, initiate adult CPR for cardiac arrest.
To find the hand position, place the heel of the hand 2 fingers above the bottom of the sternum. Crawl up the ribs, place 2 fingers above the bottom of the sternum, and plant the heel of your hand above the 2 fingers. An alternative way to landmark or find the hand position when doing CPR is to take the heel of the hand and place it directly in between the chest muscles, also known as the lower half of the sternum.
When giving 15 compressions, keep your arms at a 90-degree angle to the body, keep elbows locked, compress sternum 1.5 to 2 inches. Do 15 compressions in 9 seconds, about 100 compressions per minute. Keep fingers off the chest.
Give 15 compressions, 1.5 to 2 inches deep. Compressions will force the blood out of the heart and circulate it throughout the body. Give 2 slow breaths to oxygenate the blood now. Continue 15 compressions and 2 breaths for 4 cycles. CPR circulates and oxygenates the blood. It helps to keep the brain and vital organs alive. A few things to remember when doing CPR is to keep your arms at a 90-degree angle to the body. Keep your elbows locked. Make sure your arms are straight up and down. When doing compressions, make sure that you're pushing at least 1.5 inches to 2 inches deep. If you feel the ribs break, keep going. Let's sit back and watch the rest of the 4 cycles. Once you have completed 4 cycles of 15 compressions and 2 breaths, stop CPR and recheck for signs of blood circulation for no more than 10 seconds.
If the person is still not breathing and has no signs of blood circulation, continue adult CPR for cardiac arrest.
Let's take a look at CPR simulated on a real person.
Continue CPR until emergency medical personnel arrive and take over. You are too exhausted to continue. Signs of circulation return. The area becomes dangerous. Things to consider.
To rescue or CPR can be done if there is more than one trained person at the scene. Each person on opposite sides of the body will share the responsibility of giving 15 compressions and 2 breaths.
And 1, and 2, and 3, and 4, and 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. And 1.
A person in cardiac arrest requires CPR to provide oxygenated blood to the body. Without CPR, the brain dies within 4 to 6 minutes. Early CPR and defibrillation increases the chance of survival.
Defibrillation.
I think that was all for the scope of this workshop. If there are any more questions, please. Thank you.